Okay, great. Yeah, thank you for being here. And I'm Lindsay. I wanted to do this webinar just to kind of bring some awareness to thyroid disorders. There are so many of us out there that have thyroid issues, and we tend to hear that everything is normal, your labs are normal, even though we are just suffering and continue to have symptoms and problems. So I just wanted to bring some awareness and talk about, issues with the thyroid. Could it be your thyroid? Is that something that could be on your radar based on what you have going on? So yeah, let's get to it. And as we go, if you have questions, feel free to type in the chat box, and otherwise we can get to questions at the end. All right, and I'm Lindsay. I am a registered dietitian. I've been a dietitian for 15 years. My current specialty is in integrative and functional nutrition. I see women with thyroid disorders, and then I also have clients that I work with for food sensitivities. I'm a certified lead therapist, and that's the program that I work with for food sensitivities. I'm also currently in a certificate of training course for functional nutrition. And I have a husband, Dan. We have 3 boys and a dog, Ace. And a little bit about my story, which kind of will tell you how I got here. But I was diagnosed with hypothyroidism 3 years ago, just through some routine labs done with my primary care doctor. I had no idea that my symptoms really were related to the thyroid. It wasn't something that I had done much with in my previous career. But looking back, it totally makes sense now that I was having some thyroid issues, and it was one of the most stressful times in my life. So then I was given medication and told just to come back to recheck lab work in a few weeks. I was given no direction on how to take the medications, what the diagnosis actually was, nothing. Just here's your medication, come back. That was it. So I did what I could to research hypothyroidism. I listened to podcasts, I read, I followed people on social media. I just did everything that I could to try to get more information and just be kind of more aware of what was going on with my body. As I got into more information about the diet, I found the LEAP program, which works through food sensitivities. I decided to go through this course and was certified there. And then I decided I wanted to continue my career in this path. And so I started a private practice 2 years ago and focus on thyroid disorders and food sensitivities. So I'm excited. I love this work. Okay, so here's what we'll cover today. We'll talk a little bit about thyroid physiology, really basically how the thyroid works, thyroid disorders and symptoms, lab testing, other labs that I would recommend having done as well, some functional lab testing options, and some root causes of thyroid disorders. Okay, so talking a little bit about the thyroid. So it is a butterfly-shaped gland located at the front of the neck. So it sits just below the Adam's apple in the neck, and you can see in this picture here, and it wraps around the isthmus. And the thyroid gland produces hormones that are involved in many processes in the body, including metabolism, digestive function, brain development, body temperature, and heart rate. So really there's a thyroid receptor cell, a receptor on every cell pretty much in the body. Okay, so talking about thyroid physiology a little bit more. Okay, so it starts in the brain. So we have the hypothalamus and the pituitary gland. So the hypothalamus will produce TRH, which is thyrotropin releasing hormone. It signals the pituitary gland to produce TSH, which is probably more commonly or more well known. So TSH then will signal the thyroid gland to produce thyroid hormones. So we have T3 and we have T4. So it produces T3 in a much smaller amount than T4. So we rely on the body to convert T4 to T3, which is the active form of thyroid hormone. T4 can also be converted to reverse T3. And we'll talk a little bit more about those here in just a second. The thyroid also, all these together work on a negative feedback loop. So when there are a lot of thyroid hormones circulating in the body, it will signal the pituitary gland to stop producing TSH, Okay, so we'll see a low TSH and we will see high thyroid hormone levels. Okay, the opposite, if we don't have enough thyroid hormone levels, it signals the pituitary gland to produce more TSH and more TSH. Like, come on, thyroid, we need you to produce more hormones. Okay, so we see a higher TSH, but we're seeing low thyroid hormones. Oop. Okay, so a little bit more about each of those hormones. So T4, or thyroxine, is produced by the thyroid gland. So it is produced at about 80 to 90% compared to T3. So it produces a lot more T4. It's mostly inactive, okay, and we must convert it to T3 really in the liver, the gut, and kidneys. T3, or triiodothyronine, it's the active form of thyroid hormone. So it's produced at about 10 to 20% compared to T4. So most of our T3 must come from the conversion of T4 to T3. And it's 10 times more biologically active than T4. So really we rely on T3 for all of the functions that impact our health and well-being. So like our GI tract and our growth and our metabolism and all those things, we're really reliant on T3. And like I mentioned, every cell in the body has receptors for thyroid hormone. Okay, so a few statistics. It's estimated that 53 million in the US have an autoimmune disease. 30 million women have Hashimoto's disease, according to Dr. Aviva Ram. And it's estimated that 60 million have low thyroid function, most of which are undiagnosed. It's also estimated that about 90 to 97%, you'll see it kind of varies between sources, but 90 to 97% of those with hypothyroidism actually have Hashimoto's disease. So of the 60 million that have low thyroid function, we could be seeing close to 58 million that actually have Hashimoto's disease. And how many of those cases out there are undiagnosed? Lots. Just the testing is not being done. And we'll talk about that too. All right, so let's get into more about the thyroid disorders and symptoms that go along with those. Okay, so the most common one that you'll hear of is hypothyroidism. So hypothyroidism is a state of having low levels of thyroid hormone in the body. Okay, so if you kind of think back to that thyroid physiology picture, so if we're having low thyroid hormone levels in the body, it's signaling the pituitary to continue to produce more TSH, more TSH, more TSH, to signal the thyroid to produce more hormones to get those up. So when we have labs, we typically see a high TSH, but we're seeing low T4 and T3. Okay, so it can be confusing because a lot of times we'll think the high TSH, which is typical, the typical lab that's done, we think of that as like hyper, as being high, but it's a low thyroid function. So symptoms that go along with hypothyroidism, the main ones we typically see are weight gain and weight loss resistance, fatigue. So a lot of times this is debilitating fatigue, and it's really different for everybody. Constipation, brain fog, sensitivity to cold, or having a low body temperature. So you'll hear a lot of women with thyroid disease talk about how cold they get, even when it's warm outside, that they're just always so cold they need a bazillion blankets. And that's true. It decreases your body temperature. Okay, we see hair loss and hair thinning, especially at the outer edges of the eyebrow. Dry skin, puffy face, brittle, cracking nails, infertility can be a symptom that there's a thyroid issue going on. Anxiety and depression, irregular menstrual cycles, high cortisol or high cholesterol, joint aches, and hoarseness. Okay, so that's a little bit about hypothyroidism. And now Hashimoto's disease is the autoimmune disease where the immune system attacks the thyroid gland, which eventually will cause dysfunction of the thyroid. So with Hashimoto's disease, the labs that we're looking at are the antibody labs, so TPO and TG antibodies. About 90 to 97% of hypothyroidism cases are Hashimoto's. Okay, so I mentioned that before. So this really is a problem with the immune system and not an issue with the thyroid itself. Over time, so the more that the antibodies are present and attacking the thyroid, then we will start to see those labs kind of get out of whack, and then we'll start to see more labs associated with hypothyroidism. But not everyone diagnosed with Hashimoto's will have hypothyroidism. So if it's diagnosed early, there's a chance that those labs still will be within a normal range, okay? Symptoms of Hashimoto's are usually similar to hypothyroidism. They are often misdiagnosed or individually treated or brushed off if thyroid levels are not yet out of range, okay? So think of like depression and anxiety. So a lot of times if other labs are not out of range, they'll send you home with an antidepressant medication. Or weight gain. We're just told to eat less, exercise more, for weight gain because thyroid levels look normal. But what we aren't saying is that the antibodies are tested to look for Hashimoto's disease. Hopefully that makes sense. Okay, so then we have hyperthyroidism and Graves' disease. So those are a little bit less well known with thyroid disorder. So hyperthyroidism is the opposite of hypo. So it occurs when the thyroid produces too much thyroid hormone. So when we look back at that thyroid physiology picture, it's the complete opposite. There's too much thyroid hormone circulating, so the pituitary stops producing TSH because it doesn't want to signal the thyroid to produce more hormone. So there's too much in the body. So we usually see a low TSH, and we're seeing high either the T4 or the T3 or even maybe both. And then the TR are the antibodies that are checked for Graves' disease. So that's thyroid stimulating hormone receptor antibodies. And then Graves' disease is an autoimmune disease associated with hyperthyroidism. So with hyperthyroidism, we're seeing a lot of the opposite symptoms that we did with hypo. So we're seeing an increased appetite with unexplained weight loss. So a lot of times, and I had a client a while ago, but she would say that I'm hungry all the time and I eat and I just can't gain weight. I can't gain weight. Nothing is helping. And so a lot of times they're losing weight and continue to eat and it doesn't help. Difficulty sleeping, excessive sweating, and heat intolerance, and those will go hand in hand. A lot of times you'll see a swelling of the thyroid, also known as a goiter, frequent bowel movements, fatigue, fine brittle hair, nervousness and agitation, and rapid or irregular heart rate. And then if it's an advanced case of Graves' disease or hyperthyroidism, a lot of times we'll see problems with the eyes. Sometimes the eyeballs will protrude a little bit. So there's some eye issues that go along with that. Okay, let's talk a little bit about lab testing for the thyroid. So I recommend getting a full thyroid panel run, okay? Because that's really the best way to give us a big picture of what's going on with the thyroid. And if it's not the thyroid, is there another issue going on? Is it a pituitary gland issue? Is it an immune system issue? So the thyroid panel is really the only way that it will tell us that. We also want to look at thyroid labs from a functional range and not just a conventional range, okay? And I'll show you what those ranges look like too. I am in the camp that I recommend to get antibodies tested, and I think that it's important to determine if there's an autoimmune disease present. Okay, so remember the percentage of hypothyroidism cases that are actually Hashimoto's. It's a huge percentage. And doctors don't test antibodies a lot of the times because it doesn't change their treatment plan. So I've had clients before that I've recommended having these tests done, and their doctors will just say no because there's no reason to do it. But if you have an autoimmune disease, you are way more likely to have another autoimmune disease. And some of those go hand in hand. So I always think it's important to know that information. And it can also guide our treatment plan. So when asking for these labs to be done, I recommend asking the doctor first if they will run them. Sometimes they will, sometimes they won't. And I will even write letters for my clients to have their doctors test these and just put in there the why. Also, I recommend checking with a doctor or your insurance company to see how much it will cost, because a lot of times these, if they don't code it right, will be super expensive to run. So you can order labs on your own through some other options like Ulta or True Health Labs. And I use DHA Labs as a practitioner to run these for my clients, but thyroid panel is absolutely important to have done. Okay, so what's included in a thyroid panel? So TSH first, and this is the most common lab run. Really, you'll have that done by your doctor pretty much every year standard. So it stands for thyroid stimulating hormone, which is again produced by the pituitary gland in the brain. This is a lab usually run to diagnose a thyroid disease and determine whether medication is needed. It's high in hypothyroidism, low in hyperthyroidism, and alone, if this is the only lab that they're running, it's not an adequate marker of thyroid function. It doesn't tell us what's going on. Remember, TSH is made in the brain, not the thyroid, okay? Free T4, so there's free thyroid hormone and then there's total. So there's the free is what we want to look at because thyroid hormone can be bound to proteins and not be able to be used, where the free thyroid hormone is what's going to be able to be used in the body. So we want to look at free T4. So it's going to show us the amounts of T4 in the body, okay? Can show us that the thyroid gland is functioning properly and producing enough hormone. It's the T4, the amount that's unbound, again, and able for our cells to be used. We also need enough T4 so that we can convert that to T3. Okay, low levels can be a sign of an underactive thyroid. And then free T3, this is the one that most doctors do not test. And this is the one that can tell us the most information. Remember, we talked about if T3 is low, if you don't have enough T3 hormone, you're going to still see symptoms, okay? So free T3 is the unbound T3 that our cells can use. And most of that needs to come from conversion of T4 to T3 in the liver and in the gut. Okay, and then we have the antibodies. So we have TPO and TG antibodies. So thyroid peroxidase and thyroglobulin antibodies. So these will really tell us whether there's an autoimmune disease present, okay? These specific antibodies target the thyroid cell proteins. And if they're elevated over time, then can cause the thyroid to lose function. And then reverse T3, this is another one that's not often run. Okay, so it's the opposite of free T3. It's inactive and can block thyroid receptors. It's produced in times of high stress as a way to give the body a break. And so if you remember on that thyroid physiology picture, I had the T4 can be converted to T3 and reverse T3. So if there's a lot of stress going on, then we tend to see reverse T3 be a little bit higher. Okay, it can also tell us if there's poor conversion of T4 to T3, if we're seeing a higher reverse T3 compared to T3 ratio. Okay, and here's lab ranges, and I just put this on here to show you that when I talk about functional lab ranges, how different those can be compared to typical lab ranges, especially when we talk about a TSH. Okay, so TSH, the typical lab range is 0.5 to 5.5. Functionally, and you'll see it look a little bit different. I typically say 1 to 2. Some people will say up to 2.5 or maybe 0.8 to 2.5. But if you're going in and if you're getting a TSH run and it's a, let's say it's a 4.1, okay, and your doctor's like, oh, that looks normal. Well, that would be what I would consider pretty high for a TSH, where you might be seeing some symptoms, and I think we need to dig further in to see if there's anything else going on. So if we look at the other ones, they're not quite as big of a range, but like free T3, I want that to be a lot higher on a functional range, up into the 3s. A 2.3 and a free T3 is super, super low. Okay, and then you have antibodies, and you'll see a lot of different things for antibodies. Typically, they say negative or less than 4. Sometimes you'll see less than 10. But if we're getting above that, then there's definitely some autoimmune stuff brewing. And then reverse T3, we typically want to see it under 15 or use this reverse T3 to free T3 ratio. And this is just what I use with my clients when I look at their thyroid labs. All right. And then other labs that I would recommend to have done that can impact thyroid or vice versa, blood sugar labs. Okay, these are going to be a big one to have checked. So fluctuating blood sugars, or what we call dysglycemia, can cause more stress on the body and increased inflammation. So this means that you're having high blood sugars and you're having low blood sugars. So when you're having a high, a lot of times you'll rebound and have low, and you'll typically see symptoms of those. Like with high blood sugars, a lot of times we see cravings, especially sweet cravings, or still being hungry after meals. low blood sugars, we tend to see more like hangry. If you're like, you get to the point where you need food immediately, or kind of get really shaky when you skip meals, or you haven't eaten in a while. Those are signs that you're having some dysglycemia. And blood sugar problems can also lead to weight gain, and having problems losing weight, okay, which kind of goes hand in hand with thyroid too. So the blood sugar labs I recommend would be a hemoglobin A1C. So that's like the basically the average of your blood sugars over 3 months, a fasting blood glucose, and then a fasting insulin. That fasting insulin really can give us the most information and tell us if your insulin level has been high for a while, and that's a sign of some blood sugar issues. I also recommend having a lipid panel done. This should be pretty standard: cholesterol, HDL, LDL, triglycerides. If your doctor will do it, I also recommend an HSCRP and homocysteine. Those are inflammatory markers. And then the particle size numbers of LDL can tell us whether LDL is at risk or not. So we want kind of the big fluffy particles that will bounce around instead of the really small particles. And then other labs that are pretty standard would be like a complete blood count. That would be helpful as well. And then these are some functional labs that I use in my practice. So we have the option to do micronutrient testing. Okay, so we can determine if there's any nutrient deficiencies or insufficiencies, which can cause worse problems with symptoms and health conditions. So I love using this for like if there's problems with hair and nails, like brittle nails or hair thinning, because a lot of times that can also be nutrient deficiencies. Frequent illnesses like getting colds or, pretty often, or feeling like you're always sick. Fatigue, really any of these are going to be great for fatigue. And then mood issues can be related to micronutrient testing. I also have the ability to do the Dutch hormone test, and Dutch stands for Dried Urine Test for Comprehensive Hormones. So it's a comprehensive hormone panel. It tests sex hormones, stress hormones, the metabolites, and melatonin. So I love this for fatigue, weight gain, weight loss resistance, irregular menstrual cycles, sleep issues, mood issues, anything that we really can kind of relate back to hormones. This is a great thing to test. We can do the GI map stool test. This is a comprehensive test of the microbiome or the gut. Great for digestive issues, fatigue. If we see frequent antibiotic use, because then we can test and see what the bacteria in the gut look like, if there's enough good bacteria, if there's too much bad bacteria, if there's a lot of yeast or pathogens, anything like that, we can look at with the stool test, and that can give us a lot of information. And then we also have the MRT food sensitivity test. This tests immune system reactions to foods, so it's different than food allergies, and it's great for skin issues, headaches, migraines, sinus and allergy issues and symptoms, fatigue, GI symptoms and disorders, like IBD, IBS, and autoimmune diseases. Okay, and let's talk a little bit about root causes. And I put this on here, I know this is a lot of words, but excuse me, just talking a little bit about functional medicine. And this is kind of the way that I like to practice nutrition. So it's addressing the underlying causes of disease using a systems-oriented approach, engaging both patient and practitioner in a therapeutic partnership. Okay, so working together to try to get to that root cause. Functional medicine involves understanding the origins, prevention, and treatment of complex chronic disease. Okay, it integrates traditional medicine practices with what is sometimes considered alternative or integrative medicine, creating a focus on prevention through nutrition, diet, and exercise, lab testing, diagnostic techniques, and then prescribing of whether it's diet, supplements, herbs, stress management. So it's not always just medications. And this, we kind of talk about functional medicine from a root. I love this tree because it talks about like the root, and you have the root causes, things that can really cause these problems that you see up here on the leaves. Okay. And then as far as root causes go, we really want to know why the thyroid is malfunctioning. What is going on? Because we can treat it, and we can, your doctor can prescribe you thyroid hormone, but that's only going to get you so far. If we can figure out the reasons why it's not working properly, then that really can help you to feel better long term. So we can look at nutrient deficiencies. The thyroid requires lots of nutrients in order to function properly. So we're looking at iodine, which is a key part of thyroid hormone production. Zinc is really important for making thyroid hormone, as well as the conversion of T4 to T3. Zinc does a lot of things in regard to the thyroid. Same with selenium. We need that to convert T4 to T3. We also need vitamin D. Vitamin D does so many things in our body. So one of the root causes we can look at is nutrient deficiencies. Are those causing problems with the thyroid? Autoimmune disease. Okay, so is it really stemming from Hashimoto's or Graves, like we talked about? And there's also a lot of root causes of autoimmune disease, which some of these will kind of be the same, but stress. So chronic stress can really slow down the thyroid. So the hypothalamus is also a part of the HPA axis. If you've ever heard of that, the hypothalamus pituitary adrenal axis, and it is what works with the stress response in the body. So when there's a high amount of stress, the hypothalamus and the pituitary gland are not going to work as well because they're really focused on that stress response and not thyroid function. Stress can also affect the immune system and can be a root cause of autoimmune disease. We also see stress, and we also see a lot of thyroid issues pop up in pregnancy and postpartum because it's a major time of stress and hormone change. So we tend to see thyroid issues pop up there too. And in menopause, that's another area where we see a lot of thyroid issues pop up. Okay, so we can also look at infections. So there's viral type infections like Epstein-Barr, herpes, Lyme. We can look at gut infections, which is a great use of that GI map stool test. So we can see H. pylori, SIBO, which is small intestinal bacterial overgrowth, possibly parasites or candida. Is there something going on in the gut that's causing problems with the immune system or with the thyroid or just in general? Toxin overload. So some of us really are not good detoxers, and toxins can build up in the body and cause problems. So we can get toxins from our food and our water, environmental toxins, and chemical toxins. So we think of like cleaners and beauty products, things we're putting on our body, not just what we're putting in our body. And then we can see food sensitivities as root causes too. So food sensitivity, like gluten is a major one, which can cause intestinal permeability. Food sensitivities can also increase the activity of the immune system, which then can lead to autoimmune disease. And then just kind of to wrap up a little bit, just my top tips, if you think that you're experiencing thyroid problems, or if you know that you are and are still struggling, I recommend to find a doctor that will listen to you, that is willing to do more testing, open to different treatment options. Functional medicine doctors often will fit this bill, but you can also find different doctors that will. So I know it's hard to bounce from doctor to doctor, but it's super important to find somebody that will listen to you. Keep advocating for yourself and for your health. So don't give up. Keep searching for answers. Get the help that you need. It's super important. And then sometimes it's really helpful to make a timeline of your life. And this is one thing that I did when I started working with a functional medicine doctor, because it's good to see if you have major life events or health things that happen that could kind of be that root cause of your health issues or of your thyroid disease. So think about if you have any like major deaths or things in your life, any accidents, any traumas, any like medications that you were taking as a child. Those types of things are super important to know. And then I recommend starting with what you can control in your life right now. Can you work on stress? Can you work on getting enough and some good sleep? Can you work on your diet and your lifestyle? So start with those things that you can control until you know the other things that would be beneficial for you to work on. And then here's just some ways that you can connect with me. So if you're on Instagram, my Instagram handle, and then I just started a Facebook group, so Optimal Thyroid Nutrition and Wellness Facebook group. And then this is my website. And I'll send this out also so you'll have all of these. And then with clients, I work one-on-one virtually with clients. So we have the option of doing video and phone visits, which is so nice in this time where we can't visit one-on-one together in the same space. So virtual visits are so nice to be able to offer. I do 3-month programs and offer individualized recommendations and protocols based on health history, symptoms, labs, all of those things when I work with clients. So if anybody's interested in learning more, you can get on my website and apply to work with me, and I'll send you a link to schedule a discovery call. And I just use that as a way to learn more about your story and your struggles and your goals, and to find out if we would be a good fit to work together. All right. I will open it up if anybody has any questions. I'm going to stop sharing this and hop on here. Okay, so Tracy asked, can you explain the difference between the typical range and the functional? Why do physicians use typical? Okay, so that's a really good question. So typical range, that's what they know. So they're based on, the way that they develop these ranges is they have so many people test, and they kind of develop it based on this, like, here's how many are sick and here's how many are healthy. So we're going to kind of do this range. That's not a very good description of how they determine that, but it's not taking into account what's optimal. So from a functional range standpoint, we're really looking more at the optimal range for you to feel your best and to feel your healthiest. Outside of that range can maybe lead to other problems and other diseases. Does that make sense? So if you think of that like in other labs as well, like blood sugars, that's kind of a big one. So, hemoglobin A1C, they want to be below a 5.7. Well, if you're at a 5.6 and they're telling you that that's normal, then that's a problem, right? Because you're basically almost to the point where they would diagnose you as pre-diabetic. So when we're looking at optimal, it's basically what is the best case scenario. Hopefully I answer that for you. They are using baseline versus what is optimal. Absolutely. And I find that thyroid labs tend to have really wide ranges, especially when we're talking about TSH, which is typically the only lab that they test. So the ranges really, really vary there. And that's not to say that somebody that's just outside of the range isn't okay. We also have to take into consideration really symptoms and everything else that's going on. So just because the functional range is 1 to 2, if you're at a 2.2, but you're not really having symptoms, I'm not going to say that you're having thyroid issues. Does that make sense? So we kind of have to take that also into consideration. That's a good question. Anything else? All right. Well, I have this recorded and I will send it via email to everybody that registered. And I appreciate you all being here. And when I send that, if you have any more questions that come up, feel free to just email back and ask those questions and I can get back to you. Also, or find me on Instagram or Facebook, and we can have discussions there as well. So thank you. Have a good rest of your evening.